Okay, so I saw a video on TikTok and I want to respond to it. It's about Seroquel or quintiapine. Now, of course, speak to a psychologist or doctor before you whatever. This is the guy whose video I'm replying to.
Quetiapine or Seroquel, explained by a psychiatrist. Quetiapine, also known as Seroquel, is doing the rounds in the media and on social media at the moment. Unfortunately, media coverage can sometimes sensationalize these stories, while social media can amplify misinformation and fear. So let's cut through the noise and look at the facts. Hi, I'm Professor Ahmed Hankir. I'm a consultant psychiatrist and prescribing psychiatric medications, including quetiapine, is part of my clinical work. Quetiapine is a second generation or a typical antipsychotic. But despite the name, we don't only prescribe it for psychoses. We use it to treat schizophrenia and bipolar affective disorder. For acute mania, doses are commonly around 400 to 800 milligrams per day, while for bipolar depression, the recommended dose is typically 300 milligrams per day. It can also be used for relapse prevention in bipolar disorder and as augmentation in major depressive disorder when an antidepressant alone hasn't produced an adequate response. At much lower doses, often around 25 to 100 milligrams, quetiapine is sometimes prescribed off-label for sleep. However, quetiapine isn't licensed for primary insomnia, and we need to be cautious about using a powerful psychiatric medication simply because it makes somebody sleepy. Because even at lower doses, quetiapine is not without side effects. It can cause sedation and weight gain and can adversely affect blood glucose and cholesterol, increasing metabolic risk. Other potential adverse effects include low blood pressure, movement-related side effects, and in susceptible individuals, QT prolongation. Quetiapine can be a highly effective medication, but like all medications, it has benefits and it has risks. This video is for educational purposes only and is not a substitute for individual medical advice.
So for years I've been struggling with chronic insomnia and dealing with unprocessed grief. I got maybe 3 to 5 hours of sleep a night. I would stay up till my body would absolutely crash at like 7 or 8 in the morning, and I'd be up by like 10 o'clock. It affected my mood, my cognition, and caused muscle guarding. I ended up sustaining a neck injury in my C3 through C7, and the narrowing or whatever, bad posture, bonk in my head. The myofascial pain kind of dialed everything up and made the pain signaling worse, and I got caught in this recursive loop, and my nervous system was always activated. Constantly being on my phone for 16 plus hours a day, either my phone or my computer. Then I'd do the food before stuff, and I just would never stop. I had anxiety and nightmares. Every time I would go to bed, I'd have a panic attack, get heart palpitations. There were nights where I was legitimately concerned that I might die, and I would have nightmares from something that happened a couple of years ago yeah. Anyway, I was on a bunch of different medication for my neck and stuff. After I got the MRI and all that stuff, I was put on baclofen and pregabalin, and I was prescribed the pregabalin as a PRN when I shouldn't have been, and it was only a 30-day dose. And so after the 30 days were up, I was like, well, I got a cold turkey. Anyway, I ended up having a seizure, ended up having to go to the emergency room, and I talked with the prescribing doctor that I wanted something that my body wouldn't be as addicted to and reliant on, and I just needed my nervous system to downshift. I needed to be able to get some good sleep. So, temporarily, until I met up with my family doctor, which at that time was a couple weeks away, I had been on a waiting list for a family doctor for 14 years, I was prescribed quintiapine, or Seroquel, at 25 milligrams per day. Let me tell you that has been genuinely life-saving. It not only helped with my cognition, my reactivity, my mood, it helped me to just return to baseline, and I felt more like me than I have in years. I was able to get good sleep, and sleep is restorative. which has helped with the physio and trying to deal with all these injuries and slowing down. The need to be constantly hyper productive and always producing something, always doing something, being online, writing 10 books in those years, and just going non-stop no longer exists. So it's been a bit of an adjustment period for me, and I was on Seroquel for I think around 2 months or something, and I've since switched to mirtazapine because of the long-term effects that can come from being on Seroquel long-term. And it's working. It did take a little bit, but yeah, I'm honestly considering asking my doctor about Dayvigo or something. Because honestly, I mean, I end up lying in bed and I'm 3-4 hours now, which is a massive improvement of trying to get to sleep, and I can get to sleep. Before it would have been like, I'd be there for 6 hours or I'd have to stay up until I just crashed. Oftentimes in the clothes that I was wearing. I've spent the better part of the last 3 years in a loop of self-hatred and chronic nervous system activation and anxiety, insomnia, and all that stuff. So Seroquel, talk to your doctor or psychologist, but it is something that is worth looking into because it made all the difference for me, and medication affects everybody else differently. But it allowed me to shut down and close the loop. And now I'm not going to be on it long term. I'm on mirtazapine. But yeah, I think the biggest problem with me is, I don't know if it's ADHD, overstimulation, my brain being addicted to that or what. But that's why I'm looking at the Dayvigo medication, because I have a really hard time sleeping. I have my entire life, but it's gotten really bad during the last few years. Anyway, that's my story. So, yeah. If you're wondering about Seroquel, don't fall for the online hype or anything like that. Nothing is a cure-all. It's not linear. But for me, it has been life-changing. I don't know that I would have lasted much longer if I kept pushing my body to such extremes. And going on that, having something that helps you get to sleep, I don't know how I functioned for all these years without it. And really, I guess I didn't. Because while it may have looked productive from the outside, I was putting myself into an early grave.